Hey, it's Chris Beyer.
Chris Bowling.
Brad Johnson.
Welcome to another Bottom Line Thursday, Brad. More insights to share this week. I know in your last newsletter, we touched last week as well on some updates to GLP-1s. But one of the articles caught my mind we wanted to spend this session on was now it's being shown that even though Ozempic costs around $1,000 a month, maybe more depending on your insurance plan, it's only costing $5 in ingredients to make. And that can't be right. But I think there's some actually good conversation about what happens when a drug comes on market that I think you shared it in your newsletter. But that was really shocking to see how much different ingredient versus actual retail.
It's the billion-dollar R&D, that's not in the actual ingredient. But yeah, it's like most high-cost drugs, right? I mean, what it costs to manufacture, but what it costs to develop is two completely different topics.
Yeah.
And Brad, what did you see from that? Yeah.
So the article was CNBC, so credible source, and they cited a study. It was done by researchers from Yale, King's College Hospital, Doctors Without Borders, and I think a few others. And they really tried to dive in to figure out, including taxes and profits, what it would cost to actually produce the drug. And to me, it kind of strikes under the headline, make hay while the sun shines, right? And I get it. They also reference that the drug costs nearly $5 billion in research and development. Now, what we don't know, I know as tax dollars get sent to pharmaceutical companies for R&D, so I don't know how much of that was totally borne by the company or taxpayers. So I will say that. But the headline was intriguing. And, as I think about it, and they don't really go into the math and all this stuff, but let's just say they have to recoup their R&D costs. Totally get it. They're a business, for-profit business. But long-term, if this only costs $5 to produce, I think the moral of the story, though, is over time, the cost of these drugs should come down. Sure. Because they've already developed the lion's share of the research, and now they're just tweaking formulations. And I joke, I'll see you back in 7 to 10 years when the patent runs out, and you can buy it for $5.
Right.
I think that's maybe the glide path, but I think 1,000. Let's hope maybe 2 years from now it's down to 700, 800. Who knows? Maybe from there, we'll see.
Well, so much of this is what we know happens with drugs, but we haven't had something that's been this, discussed in a long time when you look at everything that's on the market to really step back and say, this is what happens from R&D to distribution to long-term to patent to generic. But it is kind of crazy when you look at what the actual cost is of the ingredient.
Yeah.
Wow. Good stuff.
Bowling has a strike.
Thank you as always, Brad.
Well, I know people who are getting the Ozempic, but it's not Ozempic, because they're going to compound pharmacies and they're putting the same ingredients, not in the fancy pen, but in a true syringe, and you're having to pull out, or I'm sorry, in a vial, and you're having to pull out the syringe and stick your belly.
Wow.
And it is a third of the cost, but they're compounding the same formula as a Ozempic. So to your point,
interesting.
But they're still charging them $300 for roughly a month supply, and some people are getting 2 months out of that. Depends on how big of a dose. So and of course now Ozempic has come out with Wegovy, which is now their FDA approved weight loss drug, and Mounjaro, I forget the name of theirs that they just launched, that's now the FDA approved version of Mounjaro, that's a weight loss drug. Obesity is a crisis in our country, and we've got to find a way to help those people that are just weight loss resistant, that they're struggling for many different reasons. I don't want to say it's genetics, but it could be a endless amount of things that prevent people from losing weight. And if this starts that, and then they start to see the results and they start to feel better, and then their health journey, wellness journey goes from there, I think it's great. It's just, we got to figure out how to pay for it.
How to pay for it, as always.
I think employer resistance to covering this, let's face it, it's a cost issue. It's how do you take the healthcare buffet, as I like to joke.
Yes.
Put more things on the buffet, you got to charge more. And how do you do that so that the folks that don't need it are okay paying a little more to help those that do? And
Yeah.
I think when that gets them, if you could someday get it magically to $5, I'd be amazed. But even if you got it to $100 a month or $200 a month, I think you'd find most companies would say, yeah, this is definitely worth
Yeah,
doing.
I think that's probably the magic number.
Yep.
At
And you
least
know what?
now.
Do a 50-50 co-insurance on that drug. You want it, great. You're going to pay half of
Yeah.
it. But guess what?
Yeah.
As the employer, I'll pick up the other half. That's a
Yep.
Yeah.
I like that.
great topic again, gentlemen. Appreciate you.
Yes. Thank you all.
All right.
All right. See you next time.
See you.
All right. Bye-bye.